last, but certainly not least, I want to introduce you guys to our final panel, our community collaboration panel. Our moderator for this panel will be Miss Dana James, and she is joined by Mrs. Jacquie Easley, Dr. Yogesh Shah, and of course, newly elected, Mr. Izaah Knox. Thank you, guys.
Check 1 2 1 2. Okay, we good. So my name is Dana James. I am the founder of Black Iowa News. Welcome. Hope you guys have had a great afternoon. And so I'm here with this illustrious panel that we have assembled. They're going to take a couple seconds to introduce themselves, talk about what they do, and then we'll get to the questions.
No, you first.
Okay. Is it on? Okay. Well, hello, everyone, and happy Veterans Day. Thank you for those who served. Can we have a round of applause for those who served for us? We are able to be here speaking freely today because of those who served us well. But anyway, my name is Jacquie Easley, and I wear many hats, as you'll probably find out during our panel discussion. Professionally, my day job, where I just came from, I'm Division Director for Mercy One Iowa for Health Equity. But I think I'm on this panel because of some volunteer roles that I play. I chair the Iowa-Nebraska NAACP Conference of Branches Health Consortium. I'm also the chair for the One Economy Health Committee. And a role I just took this year is I am the vice chair of United Way, and I'm the cabinet lead for early childhood, all of which are passions for me, intersectional. And so I'm happy to be here today to kind of share some of what I learned.
Fantastic.
I'm Izaah Knox, yes, Senate-elect for the Iowa Senate. Thank you. Thank you. Also the Executive Director of Urban Dreams, Des Moines Civil and Human Rights Commissioner for a couple more weeks, a couple different board things too. But I think that I'm on the panel to talk about really the community collaborations that we've had. Urban Dreams has been around since 1985. Many of you probably know my predecessor, Wayne Ford. And when we started Urban Dreams, we were really just a place that was in the community, open past 5 o'clock at night, had the lights on, had a TV, had a phone, had air conditioning in the summer, had heat in the winter. We always had hot coffee on. But then as we started to interact with the community, we tried to figure out what is best for you. And we did it organically, not trying to force things on people, but actually trying to figure out what would be best to serve them so it can be sustained over time. And that always, because of many different things, funding, expertise, or whatever it is, needs partners. So I know that's some of the questions we're talking about now, how those community partnerships work and why they become successful. But the number one thing is they have to be authentic and they have to be sustainable from the community base. So that's why I'm here, and I'm excited to be here. So thank you all.
Thank you, Senate. I'm Yogesh Shah. I'm physician and chief medical officer at Broadlawns Medical Center. And before I tell you, thank you. Before I tell you my journey and why I'm here, let me clarify one thing. Before I grew up in India, Bombay, did medical school, and left and came here. And when I came to, I did not have any Indian accent till I came to Mount Air, Southern Iowa. Yeah, nobody in India would tell me I had accent. Nobody in New York would tell me I had any accent. Till I came to Southern Iowa, town of Mount Air, Ringgold County. Population was less than 5,000 people. I grew up in Bombay with population of 11 million people. Yeah, so huge difference, long journey. I'll tell you why I'm here. Saw a lot of elderly patients, luckily went to Mayo Clinic. My smart wife said, she's not coming with me to North. It's too cold, colder than Des Moines. She stayed here, so I came back, which is true. And then went to Mercy, worked there, got appointed to be the founding dean at Des Moines University, traveled around the world. At that time, my signature would say in email that think globally, act locally. So when it came time and chance to go back to the clinical world, rather than going to Mercy intentionally, I decided to come to Broadlawns, luckily, because at 7 years ago, I'd heard through Wayne Ford that Broadlawns was looking to expand the impact in community. And I'll tell you more, we talk about it. And luckily came, and now that's why I'm here. I did my MPH when I was at Des Moines University with focus on the topic we'll talk about, social determinants of health. So that's what we'll talk about. Thank you.
Fantastic, thank you very much. So we're going to go through a couple questions with the panel, and then we'll open it up to questions from the crowd. So the very first question: effective partnerships are essential for community-based solutions for advancing health and equity. Have you used partnerships to accelerate health equity?
Let me, before I answer that question, let me ask a couple of questions, if you don't mind, to the audience. So tell me two things, and whoever knows, and there's no wrong answer. What percentage of our GDP, our gross domestic product, GDP, we spend in healthcare in the US? That's first question. And the second question is, for all of us in this room and outside, what percentage of our health depends on the hospitals and clinics what we work for? So those two questions. What is our health expenditure in US? And what is the proportionately, how much is the importance of the hospitals and clinics to maintain good health? Before I answer, the reason that question becomes important is what we'll answer, hopefully. So what is the answer? Yeah, too much, you're right. So we spend almost $4.2 trillion, $4.2 trillion, too much. That comes to 20% of our GDP. Every dollar we earn, 20% goes to our health. What percentage of our health depends on hospitals and clinics? Yes. So less than 20% depends on the health of our health, good health, not acute care, not trauma, not appendix. The chronic care depends on, 20% depends on clinics and hospitals, 30% depends on our behavior, what I eat, whether I smoke or not, how much exercise I get, and the 50% of our health depends on the topic. The question is the social determinants of health. What happens in my neighborhood, in my zip code? My zip code is more important than my genetic code. Let me repeat that. The people who live in the poorer zip code, that's why I went to Broadlawns, and that's why Broadlawns is doing what we are doing. We are in one of the poorest zip code of Polk County, 50314. The zip code is more important than genetic code. So coming to partnerships, of course, we have to have a lot of partnerships outside of our hospital systems to have good health of our community. And that's what we are intentionally doing every day, focusing on. We have luckily good partners on. Tisha was here, I don't know if she's still here, but Tisha Baral is focused on that. And we are working with a lot of, whether it's Urban Dreams, Creative Vision, SIS, Central Iowa System, Des Moines Public School, Corinthian Baptist Church, multiple partners in multiple areas to make sure that health is addressed at all these places.
And I want to give some specific examples of why partnerships are so important. I agree with calling out those statistics, because that then leads to a historical perspective or overview, or some of us know it as a historical trauma and mistrust of healthcare beginning prior to 1619. How many read our girl from Waterloo's book, 1619, where she has a section in that book where she says that even prior to becoming free, African Americans were subjected to some of the most egregious acts. African American women were used as guinea pigs for gynecological studies. Fast forward then to, of course, most people are familiar with the Tuskegee experiment. Henrietta Lacks, where her cells were misappropriated, were not used with the permission of either she. She did succumb to cancer, but neither she nor her family gave permission that her cells be used for further research, and as a result, those cells then became what we call immortal because they were used in experiments that, luckily and gratefully for us today, have solved many issues in gynecological studies for women and have helped in birth. But the fact that she was used in an experimental role, again, and then we fast forward to even as most recent as past 10 years, my fellow homegirl from North Carolina may be familiar with how incarcerated women in North Carolina and other southern states, they were involuntarily sterilized. And so all of these examples lead to what we call the historical mistrust of healthcare, and why some of the figures that you just gave are significant. Because now, as we, and we're not, I don't like to use the word post-pandemic, but as we are easing with the pandemic that we have experienced the last 2.5 years, we're now worried about some other things, RSV, and we're in flu season, to really advance vaccine equity, which Dr. Shah was very involved in. We really hit some roadblocks because individuals said, why should I trust anybody who is from the healthcare system? Thus, partnerships became important. The NAACP 3 years ago did a study, and I noticed that you're using research from Robert Wood Johnson, but prior to that, NAACP did a study of its members and asked how many, now this is early on, this was early winter of 2020, how many would be interested in a vaccine to prevent the spread of the coronavirus. At that time, it was less than 20% of our members. So immediately, the NAACP said, we need to be a trusted partner. And the NAACP then gathered medical professionals from the National Medical Association. I know you're familiar with that, Dr. Shah. That is the American Medical Association, predominantly homogeneously white Caucasian members, and National Medical Association were professionals from our historically black colleges, Howard, Meharry, and Fisk. And they came together and came up with a way to do outreach through the resources that they had at their medical schools, historically black colleges, partnered with the NAACP, started a program about awareness, COVID no more, no KNOW more, to know more about vaccines. And the NAACP said, we're not going to tell people what to do, but we're going to give people information, which that's what had been missing for the last 250 years, was actually having an organization say, we want to bring you accurate, relevant information about this particular issue. And so then when the the vaccine was approved, and by the way, one of the scientists, infectious disease scientists who work on the vaccine, again, a native of North Carolina, who worked for Dr. Fauci, she herself, a young African-American woman, said, even in my own family, there's mistrust. And I am a person who's actually working on this vaccine. So she appealed again to community, what we call trusted partners, such as the NAACP, such as historically African-American fraternities, sororities, others, other nonprofit organizations that have primarily been involved in social justice. And she said, we need to come together and really present this information. So the NAACP then moved from the elevation and awareness, which was COVID no more, to what we call shots in the shops. And taking the lead that Dr. Shah started with my church, my home-based church, to bring shots to where the people are. Shots in the Shop was an NAACP initiative to educate and help barbershops and beauty shops, remember, who have been dormant for about 14 months during COVID, and give them kind of number one, a shot in their own arm by providing them stipends to have information in their barbershops and beauty shops about the vaccine and how important that was. And Dana, thank you. You did a wonderful story for us in Black News Iowa. And then led to, now we're still using the same kind of networking system to talk about RSV and flu vaccines, because we're going to be hit with the triple whammy. We are being hit with the triple whammy as I speak. So community partnerships are key in, number one, not undermining, but eliminating that still present hesitation about healthcare as an industry and healthcare in general, and bringing it more to a grassroots level. And have we been successful? How did we do with vaccines? We did great with vaccines, and a little later I'll talk about another project that I'm working on related.
So as the grassroots organization, I'll talk about 3 quick initiatives real fast. I'll try to be brief, but I don't know. So Urban Dreams is a full-service outpatient substance abuse treatment center. And we used to have a standalone LISW mental health organization or counselor at our office as well. So a couple years ago, 9 years ago when I started taking over Urban Dreams, I had to do an audit every year for both of those programs. The substance abuse audit is a lot easier than the mental health audit. So as we were going through that, I'm like, and we kept getting put on probation. So we were really good at providing the service, but we really weren't good at doing the back end. So Broadlawns, who had always been one of our great partners, I said, hey, listen, we know that people want to come to Urban Dreams to get their mental health services. And this is 9 years ago, even before the pandemic hit. And in order to make it a place where it's a trusted source in the community, it's been around forever, it's different than going to a hospital, it's different than going to somewhere else, we need to keep our mental health counselor here. Broadlawns stepped up and said, listen, we'll take over the mental health portion, the management, but we'll keep your same counselor at Urban Dreams. So the continuation of services was exactly the same for everybody else. They just had to fill out a couple different pieces of paper and saying, now we're billing through Broadlawns, or our paperwork or our confidentiality has to go through them. But our clients didn't have any disruption. And that's how partnerships work. When we're not good at something, somebody else picks us up. But the things that we are good at, being a trusted resource in the community, that's where we step in. Another partnership we had with Broadlawns during the pandemic, and we got in trouble for this. When the shots went down to 16 and above, we were already ready, and the Meskwaki tribe had a bunch of vaccines that they had to get rid of. And they came to me, because I know people from networking, and I said, well, they had just done one at Corinthian. Ben Graber's on our board. We need to do one at North. People at North trust Urban Dreams. They don't trust other kind of healthcare organizations. What a better way to have brown people from Meskwaki coming down giving shots through organizations that are trusted for 16-year-old people. And we had the largest high school vaccine clinic of any high school, and we got a kind of a cease and desist order of doing it, but it was worth it, right? Because but you have to understand, right? We didn't have time to wait. Right, we had the time was now to act. We had to get our hands slapped afterwards for doing that, but we knew that we also were going to be the most successful organization to lead that initiative, partner with Broadlawns, partner with Meskwaki, and getting that done for so many people. And those are the kind of things that really make it worthwhile to do the job. 9 years ago, when I first started another thing, we partnered with One Iowa, Planned Parenthood, DMU, Broadlawns, Mercy, all these organizations, and started to have health fairs in our community. And those health fairs were really intended to try to find people their health care home, but it was also to serve the community. We weren't holding them, if you don't sign up to have a healthcare home, if you don't sign up for insurance, you can't get services. No, because that's not how we are. We want to have no barriers to entry. We want to treat people with the dignity and respect that they deserve, regardless of sometimes how they treat us. Oftentimes we have to say, hey, come back tomorrow, let's try again, but you're welcome back tomorrow. And that's really what the grassroots organizations do. But again, we're not professional. Like, this is not our expertise. I can't go to Broad Lawns or Mercy and tell them, I'm not going to go tell you, how to fix somebody's.
Now you can.
Now I can. But we also, as a grassroots organization, has been around for so long in the community that's trusted that, it's hard for organizations to come time and tell us, like, well, how do you do that so fast? Because we can pivot on a dime. We don't have a lot of red tape, right? We can get to the community, or we can, because of our food pantry, we see so many people. We can see what people need, what they want, what they desire, and thank goodness we have partners that are professionals and can come in and fill those voids that we can't do.
And I wanted to mention.
You got your own mic.
Uh-oh. Hold up. Wait a minute.
Yeah, no.
See how quick they turn?
Friendship. Oh, yeah, I need a big mic. Okay. This is probably going to be the takeaway from the conference.
Okay.
One thing I wanted to point out is, as a result of some of the grassroots work that the NAACP and others were doing, the CDC kind of got smart and decided to publish this guide for community partners. So see me if you're interested in reviewing it. And in this particular guide, the information was related to increasing uptake of vaccine awareness among members of racial and ethnic minority communities. So now that they understand how important it is to have these trusted partners, this work now is being documented using pilot studies. They actually did use the NAACP's COVID No More as one of the pilot studies in one of these briefs.
Great. So the next question, how do you get more community into these conversations that you're having about partnerships, about improving health equity? How do you get community in there?
So let me start. I can go ahead. So as Jackie was mentioning, the reason we Broadlawns went to Corinthian, and when we talked about this vaccination project, I thought there'll be about probably 300 people who'll come for this free vaccine, and we had to use 1,000. As you might recall, the Pfizer trays used to come for 1,000 patients, and we had 1,000 patients. So why did it work at Corinthian? That the relationship had started years before this event happened. It didn't happen that on that March 20th, we decided to give vaccine, and I called Reverend Whitfield on March 15th. It didn't happen that way. 7 years ago, prior to that, and I'll if you don't mind, give you, I think it's a meaningful story. My white nurse at Broadlawns, in my memory and geriatric clinics, Karen, asked me one morning, said, Dr. Shah, how come we don't represent patients from our community? And I didn't get it. I said, what do you mean, Karen? I said, how come we don't have black patients in our memory center? And out of that came some research, and out of came the community relationship with Corinthian Baptist Church. Just so you know, and Brianne from Alzheimer's Association, she's here, and she reminded me too, that dementia is twice more common in African American patients. Dementia is twice more common in African American, but half diagnosed. So out of that came that I went to Corinthian Baptist Church much prior to pandemics, 5 years ago, to talk about the church, say, hey, dementia is very common, people are not coming to the clinics, please go get treatment. I don't need patients at Broadlawns, but go anywhere. Go to Mercy, go to Unity Point, get the treatment. So to the point, the relationship starts not for need, but starts in genuine way. And then it goes as far as it needs to go. Out of that, we came not just one church, the Jacquie and the group now have group of churches of minorities, 20 plus, who are willing to now listen to any health topic.
I have to agree, right? The relationships are key, but also not caring who gets the credit for things when we do it, and making sure that the services to the clients are always your number one priority. At Urban Dreams, one thing is we can say, hey, the clients can never know what's going on in the back room. They have to think that everything is here for them and make sure that they're going to have the best services. We can be fighting in the back about something that, you know, we ordered the wrong donuts or something. Who cares? Give the donuts. They don't need to know that there's a problem with that. So that's the number one thing. But yeah, the relationships, and we're such a small knit community, and most people know each other. I mean, we look around, I see so many people in the room that I know and I work with and work together or work for. When we see issues, we have to solve them. We can't have meet to talk about, next year we're going to do this initiative. No, people in our communities, the people that we serve, the underrepresented, the marginalized people, they need the services today, now, and they need them to be authentic, sustainable, and to the best quality of anywhere else that they would get. You shouldn't have to go out to West Des Moines, or West Des Moines shouldn't have to come in here, right? Like, this should be the highest quality of services.
Although many of us have sites in West Des Moines, so I'll just put a plug in for that. But I do agree with you that it's important to be able to be authentic, and I think the key to what we're all describing here, I like the words that you use, that we have to, number one, not take credit, for what we're doing, because it's so important. Again, I've already laid the historical perspective of the mistrust. So I hope when people listen to me and hear me, they know it's because I have a love for my community. I'm from here. I want this community to be sustainable. And if wherever they go to get health care, I want them to get the best, to have access to the best health care, and that we all really have a genuine interest in healthier communities. I think that's what we're all three saying. But kind of going from the vaccine, I think everybody understands how we work together on the vaccine. We have another critical problem here in central Iowa, and that is where African American women are 3 times as likely to have negative birth outcomes. And so that is why I agreed to chair the early childhood committee at United Way, because we need to address that issue from so many different fronts, similar to the vaccine, but from the front that we need to we need to have understanding of preventive care. So preventive health care is important. We need to have an understanding of birthing options. So that's important. And then for those who may have suffered a loss, a stillbirth, or any type of unsuccessful health outcome, we need to have mental health services for those individuals. And so I look at this issue, we know how to work together on so many other issues. What can we do to help our community come together on this particular issue? And I think that combining the resources that we have, the intelligence that's in this room, I think we can really make a difference in that area. But it's a number one actually concern of mine. After we look at mental health and the effects of what happened during COVID and our kids who are being, and I'm sure Brianna addressed this in the previous segment, but again, going back to the mistrust in our community, even related to getting help for our behavioral health issues, we've got to work together.
So let's kind of segue, because that's one of the questions that we have is, a majority of Black people do have low levels of trust in the healthcare system, according to a poll by Kaiser Family Foundation. So what else can these collaborations do to surmount that issue? Because that is a serious problem.
Can I start? Okay. A couple different things. So we have a Black LISW on staff, right? So we provide cultural competence services there. And we also found out that Des Moines Public Schools, King Elementary came to us, the principal was like, do you think that we could borrow your LASW because we have a waiting list for kids that need. So encouraging people in our communities to go out and get these skills and these degrees to be certified alcohol and drug counselors, right? So that we can provide the services, because we know we have a lack of service providers out there that are culturally competent or that look like the clients that need these services. One of the things we did, again, talking about another partnership with Broadlaws, right? The Teach and Tech program. That used to be actually everybody, the first 3 or 4 cohorts, everybody that came to the Teach and Tech program actually interviewed first at Urban Dreams because they felt more comfortable coming to Urban Dreams first before they felt comfortable going and interviewing at the hospital. And that's what people said in the community, right? That's not, we're not making those things up. That's the truth. Or we would have had more black and brown people going into the profession, right? And now, after almost 200 people through the program, it's almost like it's been there forever. Because once we get this generational change, now we have so many CNAs that are even going on to get advanced degrees and still working at Broadlawns and other organizations around this, and other people have even emulated the program. But that's it. And I tell the kids all the time, the kids, young adults, or some of them are actually much older than me that go through the program, that when you're walking around now in your scrubs with your Broadlawns badge and you're at Quick Trip, I live in the 14, by the way, so you're right.
So we'll forgive you for the West Des Moines comment.
Yes. But when you're in the community, right, when you're walking around, let the kids know where you work and what you did and how you got here and how you achieved this dream and what's next for you. Because now you're inspiring more young people to go out and to get into it. And we know that healthcare, except for Nevada, is the #1 industry in every state in the country. So those are transferable skills where they can move around and even make more money in different places. So it's not only a good for giving culturally competent care, but it's good for the economy. It's good for people's checkbooks.
So just to go on Isaiah's point about this Teach and Tech program, which was the brainchild of Mr. Wayne Ford and Mr. Jody Jenner years ago. They went to Baltimore, learned from them, came back and made it a better program. So in nutshell, what that is taking high school kids from North High and East and others and giving them free certificate training into CNA, Certified Nursing Assistants, in similar way to giving to adults who can't work for whatever social problems or their past, giving them the similar certification in CNA. And hopefully, as Isaiah mentioned, hopefully it's not just doesn't stop there, but they think and look at physicians at Broadlawns, they look at nurses, physical therapists, dentists, and then they can think and dream bigger, which has happened. So we have graduated so far 100 plus Teach and Tech students, interns, and many of them are working in the healthcare systems at Mercy and Broadlawns and Unity Point, and some of them have now gone to become a physician. One is into medical school. One is, I just got heard from one who's got interview at DMU for PA. They are physical therapists, so it's that's what you're saying. So to your point, yes. Yeah, it deserves, it's a nationally recognized program enough that that Governor Reynolds took it to the White House years ago, and they were going to multiply that. So to your point, how can we do it? We have to home grow our own, who start from middle school, start from even elementary school, and then give them exposure and training so they can work in the healthcare field.
And I would add, since we started with community partners, we need to support our programs, such as Investing in My Future, such as Jules Academy, who are planting the seeds for our youngsters in these areas. So a perfect example, full circle of what we've said. We've got really good embryos for community programs here that will lift, that will provide options for young people to look at healthcare. We need to support those programs.
So this seems like a good time to open it up to questions from the audience. Does anyone have any question they want to ask this illustrious panel we have up here? Put them on the spot. Come on, wake up.
So as you're thinking of question, let me just add the importance of zip code I mentioned. And this comes from, and you have a question, just let me finish. And so the Robert Wood Johnson Foundation has done national study, It goes from zip code to zip code and compares the lifespan at each zip code. And if you compare, and there I can just give you an example, that in Kansas City, Chicago, Atlanta, the difference between the poorest zip code and the richest zip code is anywhere between 7 to 14 years of life. So that's the importance of community work. That's the importance of community partnership we are talking about. That's the importance of representing community whom we serve. I can start. So from Broadlawn's point of view, ideally for any part, as I mentioned, if 50% of our health is outside of hospitals, then the hospitals are, yes, we need them, but it should be more important to have appropriate relationship with it's any NGO or church or any school system, that we need to be there and resolve the problems before it becomes chronic issue. So to give you the reason for that is, out of $4.2 trillion we spend nationally, 75% of that amount, $3.2 plus trillion go downstream in managing chronic conditions. And we can easily invest upstream. So compared to all the European systems, the 40 countries in the world, let me stand up for this. This is an important topic. Now, this is important enough to remember why we are doing what we are doing, why this topic is so important. That in 40 countries compare where the amount of money we spend upstream is half of what they spend in the European countries. So every dollar they spend downstream in France and in Scandinavian countries, they spend $2 upstream to fix the communities we're talking about. Here, we spend anywhere between 55 cents or 90 cents in some rich areas for every dollar we spend downstream. So what is the way out is to invest outside as much as we can, and which we are luckily doing.
And I think I would like my next, it's not next, it's what I've been working on, particularly as we look at the relationship between mental health and other chronic conditions, continuing to recognize the stigma exists. And there are many groups, I know some of my champions are out here in the audience, that are looking at ways that we can reach one-on-one, whether you can reach individuals through church, through traditional nonprofit organizations, sororities, fraternities, but to really help people understand you have to feel good about yourself before you can help others in their health care journey. And so if I had won that lottery last Monday, what was it, $1 billion? I would, $2 billion? Oh.
Yeah.
It was Altadena, California, though, right? Because I have a relative there. I would invest that money into more on-the-ground roots work, as Dr. Shah is alluding to look at preventive issues, earlier intervention, and also utilizing maybe out-of-the-box, non-traditional ways to reach people and help them understand how important preventive health care is.
I agree with everything they said, right? I mean, being in the community, so we all know I just ran for Senate, and I personally knocked over 2,000 doors. My team, in the primary, knocked over 7,000 doors, and by the end of the campaign, we were well over 10,000 doors knocked. You learn a lot from people when you're out there knocking on their door and asking them face-to-face, one-on-one, what they need. We need more of that, right? Our food pantry is the way that we informally survey people onto what they need. And we know food insecurity is real, so we know that we're going to continue to have people that come there for that. Now that we have diapers there, it's even increased more, and we can ask more questions to find out what people need. But it all takes investment. You're right, right? We have a small budget, but we have good partners, so we can provide the services, but we need to know what the services that the people really need, what's keeping them from getting them. So again, why we provide them in certain places outside of your traditional organizations. I'll give you an example. People don't know this, we're the #1 OWI jail diversion program in the state of Iowa. The reason why we're #1 is because we operate closer to people. We operate in Charles City and in Burlington and Cedar Rapids and Ottumwa. We're going to Decorah. We're going to Fort Dodge. We already have in Sioux City and Council Bluffs, because that's what we do. Not only treat people with dignity and respect, but reduce every barrier for access for people to get the services that they need. And we have to do that. And if we don't look at non-traditional ways to do it, we can't. But again, if I could wave a magic wand, one of the things is to end the food insecurity that we have, but also get better, healthier options out there for people, so that we can reduce some of those social determinants of health, because we know that food is one of those things.
Agree. And not because, Deb, you asked the question, or because Iowa Chronic Care Consortium is here, but it's very important to have community health workers, people whom they trust. They don't have to be healthcare providers, but they have to be leaders in the community whom they trust, and they need few tools to take care of some chronic conditions. And Broadlawns has done work with Iowa Chronic Care Consortium, and we're going to expand that program.
And I don't know if this is going to be considered controversial, but we need advocates. We need strong advocates who understand science, and who will make legislation, who will pass legislation that benefits. Expanded Medicaid is an example. Thank goodness we do have expanded Medicaid in this state. Some states are struggling with that issue. But I think back to 10 years ago when, and you use 50314 a lot, in the population of 50314, about 40% of those individuals had insurance. 60% did not. That was unacceptable. And so one of the first really grassroots organizations that I became involved in, does anybody here remember Rockin' and Rollin' to Better Health? My radio show that I had on KJMC. These were ways that we reached people and let them know that now they could enroll based on expanded Medicaid into health insurance. And we brought on subject matter experts to talk about, when you have health care, you can get screenings, you can get prostate and all the screenings, but 60% not insured was definitely unacceptable. And so we need advocates, people who understand that these issues often start in legislation, but they benefit so many more people.
Anyone else have any questions?
Thank you all for being here today. Hi, Izaah, good to see you again. So we've talked a lot today about how important preventative care is, and obviously how it's not the moneymaker. It's not, getting those services reimbursed. It just isn't there. So how do we go about as a system, and I don't know that we have an answer, but just throwing it out, how do we go about changing that and starting the conversation to where folks who are working at that higher upstream piece of things, how do we get that to be where we place our value and can reimburse and actually fund those pieces of the work that is so crucial to catching people before they end up in this chronic space where we're dumping so much money into. Thank you.
So when we talk about the preventative care, it falls into two big categories. One is medical prevention screening, and before that is the prevention that condition doesn't even happen, and that's where the education. Two things which have shown consistently to help is education. The more education we give it to our communities, it translates into better health also directly. People who don't graduate from high school have 3 to 5 times more chronic care issues compared to people who graduate from high school. And second topic applies is people who are employed are much better health than people are not. So to go to prevention, we need to do that. That's why we're doing the Teach and Tech, that it both gives education and gives and money. once we do that, and the food and appropriate home and enough money to give medication, then comes the medical prevention, which the colons check, the mammograms and everything else we can do, which we should do free, which luckily Medicaid is doing. Medicare is slow in taking the prevention, the medical prevention, but it's happening. So we need to do that. And then the third thing becomes is promote. Because even though it's free, it's not happening. Vaccination rate is still COVID. Apart from COVID, the influenza vaccination rate nationally before pandemic was less than 50%. Even though it was well proven that, hey, it works, now it's gone down to now even less than that. So the point being, prevention comes in multiple ways, and it comes through multiple sources. Medical facility clinics are not equipped to do the prevention part by itself.
So to piggyback on what you're saying, how do you overcome the disinformation that's out there? Because that's a huge problem.
It's a huge problem. And from success of the COVID vaccination at one church, I can say that comes through long-term relationship where the church, at least leaders in the church, believe in. And then out of that comes a successful program of that topic, whether it's COVID vaccination, influenza vaccination, or prevention or dementia detection. And hopefully other churches or other groups will learn from that. So one pilot project, successful, meaningful, not selfishly that, hey, because of this, now Broadlawns or Mercy will have more patients, genuinely for the community, and then it will grow.
Well, that's fantastic in terms of, working with the churches. But what about the people who don't go to church? Because I've seen some studies that said that, fewer Americans are religious, fewer claim a religion. So what about those people?
So then I think, and you can answer this, but that way the NGOs, good NGOs which are reliable, whether it's Creative Vision or whether it's Izaah's groups, that will then make a lot of sense.
And I think some of the examples that we've talked about, going to grassroots nonprofit organizations where they have this accurate information, the shots in the shops, where we empowered and educated barbershops and beauty shops to provide that information. I'm trying to think. We did a program at Hy-Vee on Martin Luther King Drive one day to give information about vaccines. So again, going back to these non-traditional places, but as Izaah has stated many times, it has to be places where people feel that there's trust and a relationship, and a place where they think that they're good, accurate information.
One of the biggest things we run into working with, especially subject matter experts or large organizations, they don't understand that you have to do it a lot of times for a long time. And the first couple times, you may only have one or two people. That doesn't mean it was a failure. That means all the people that are looking out their window, wondering what's going on, they weren't ready to come out yet. But the next time you're there, they're like, ooh, they're back again. What are they doing? And then the third time, they might be on their front porch. And then they walk around, and then they come, right? And that's what it takes. But larger organizations, they want to see the instant success. They want to see their dollars, the return on the investment on their dollars right away. And it's not going to happen like that in our community. And we have to, advocates out here in the community, you have to make sure that organizations that you work for, that you work with, or places that you know, they're willing to make that long-term investment in the communities that are underrepresented, right? Or it doesn't work. And then both sides get frustrated because, oh yeah, they don't do anything for us. And they're like, well, we show up and we came, but you didn't show up. So it becomes frustrating for both sides, which we understand, but we have to be the ones that are going to force that agenda on people.
What other questions? Oh, we've got one over here.
Yeah, if you ask question, your pictures get taken, so please ask question.
Thank you.
Yes, it does.
Izaah, you just batted it right up for me. I was going to ask, as someone who might know of like a larger institution where they might like close a clinic and the staff were upset, like, what about these patients? They are being seen here for primary care. And the executive's response is, well, they can drive to Urbandale. and everyone's like, they take the bus. Like they're just I could go on and on, but where could we go, or and the concern of like, how are the patients gonna know? Well, we're gonna send it on their app. Okay, but this population, probably English isn't their primary language. All these barriers, and they didn't want to listen to staff. The decision had been made, in 30 days it's closing, and these people were losing their jobs, but they didn't care about that. They cared about the patients that were going to walk through that door. And the solution was, well, they can see their primary care, they'll just have to make an appointment. Again, and their day that may not happen. So what can we do to make sure that there is a place for people to go, and when those clinics are closed, people are aware, and to be able to have a seat at the table with facilities to say this isn't acceptable, and they're going to end up in the ER or not, because they're going to not get care and die at home.
I'll start and then move it down. We have to, as educated folks and working for a big organization or whatever, understand that our clients may not have a traditional education. Many of them, some do, but they do know what they want and need, right? So we have to, again, respect what they say and they tell us, in a way that just because we may know the number, all the stats and all the data and all this stuff, well, really this individual doesn't care about all that. They just want to be seen by a competent doctor that understands that their needs. So we have to understand that that's important, and then fulfill those needs for people. I live less than a mile away from Broadlawns and less than a mile away from Urban Dreams. I've lived there for 17 years, and I get out to the community every single day and ask people. Now they know. I had the same thing though. You walk up to people on 6th Avenue, like, why, but now they know that's just, Isaiah just walking down the street, like those, we have to be there, right? It took me 17 years to get to the point now that I can do that actively all the time. We just have to make sure we're pushing organizations or coalition building, so that we can collectively push organizations to not shut down clinics, or to reach out and use nonprofit organizations that do things non-traditionally. Like, we have some partners now. Like, why do you guys do it that way? Well, that's how we have to do it to reach our clients. We know that won't work for you and your clients, but that's what works for us and our clients. So you like the success, so let's continue to do it that way.
And I also think that those of us who do have roles in some of these large institutions really have a responsibility. Some of the attitudes that you were describing sound very, very common and kind of bordering on implicit bias. And that's unfortunately still exists in healthcare at the top levels. And so I highly recommend a video that the American Hospital Association has put out called Toxic, and it tells the story of a young woman trying to get, who's pregnant and trying to get health care, and this woman defies stereotypes. She's educated, she has a master's degree, she lives in a decent zip code, but every medical person that she talks to in this film, it's shameful. It's shameful, their attitude toward her. And until you can put that in front of people who are decision makers and have them understand how the decisions that they make impact someone like this woman in this video, that's just a little inch, but it goes a long way in what you're describing as, unfortunately, it sounds like implicit bias.
Absolutely. Okay, and we have just one more final comment. I know you guys have heard me say that a bunch today, but I mean it this time, so just our last comment. Thank you.
I don't even know if I need this. So a couple of the things that we deal with or that we have seen, and I'm kind of looking for your perspective on this, is, we have those members. All the way up. Okay. So we have a lot of members and a lot of Iowans that have become socially isolated due to COVID, right? Or due to other things. And we've talked a lot today about food insecurities, about preventative care, about getting them, treated. What is your perspective on getting engaged with members or Iowans that are socially isolated. And we also have a huge homeless issue as well. So I'm looking for your thoughts and suggestions on how we can engage Iowans from that perspective.
You bring up a very good point. Let me tell you some quotations. According to CDC, social isolation, this is even pre-pandemic, social isolation is considered as smoking. The bad effects of social isolation is compared to smoking 12 to 15 cigarettes per day. So, and as a geriatrician, as a dementia for brain wellness, we talk about that it's not enough to have physical exercise and healthy diet. Social connectivity is extremely important for depression and dementia. So yes, extremely important point, how to do it. I feel that's where all these organizations, the churches, church groups play a lot of significant role.
I mean, I think we've described it. Think outside the box, reach one person who is an influencer. That person has the ability to reach other individuals.
So we actually, even pre-pandemic, we were looking, it was for a couple different reasons, but once we started looking at why, like in our community is so transient, we're doing a survey question that United Way asked, how many of you know your neighbors? The pie graph was so low of how many people felt engaged in their community. So what we started to do was started to hold one event a month. Now we do 60 plus a year, and they're free for the community to come out. Again, there's no outcome that we're looking for the community except for to interact with each other. Sometimes we have 15 people. Sometimes we have, for Summer City Hoops, we'll have 300 plus people out there every single night for 11 straight nights. But again, at this point now, everybody knows that Urban Dreams is going to have an event coming up pretty soon. It's going to be food. It's going to be fun. Right. It's going to be, right. There's going to be.
I'm also on 6th Avenue.
Yeah, yes you are, yes you are, yes you are. Right, but those are the things, because we've looked at the same data and we're like, well, if you don't know your neighbor, well, first of all, it's a public safety thing. You don't look out for your neighbor if you don't know him. You're also hurting your health and all these things, right? You're probably not networking to get the next job that comes up somewhere as well. There's just so many root causes of social isolation, but it's showing up. That's the thing. It's showing up in an authentic way and letting the people in the community lead the conversation, and us not coming in with, our jackets and our, educations, trying to tell what's best for the people, letting them do it.
And as Corey asked in the beginning of this panel and conference, that taking one message I would say, which we did it before pandemic and we'll restart at Broadlawns, we call it walk with dog. So we every once a week at lunchtime, a physician, I started that, but somebody would walk, and there'll be patients and staff, and we walk together and discuss. So take home can be connecting with somebody from your work, from neighborhood, who would normally not come to your place.
Well, it sounds like that's a good stopping point. I want to take a moment to thank the panel. Why doesn't everyone give them a round of applause? And let's give Corey a round of applause too for a great conference that he worked very hard on.
Appreciate it. Thank you guys again. So we have one more break, and then we're going to get it closed out. Please, if you can, after our last speaker, stay for some refreshments and some food and just networking and getting to know each other a little bit better. All right. Thank you so much.